Hello viewers, I'm Dr. Zahoor Islam and you are watching me on my YouTube channel Zahoor Islam Official. So today I'm going to record a lecture for my students on the drugs which are used in the treatment of cardiac failures. So before starting the clinical pharmacology of cardiac failures, just take a start from the cardiac failure. Now what is cardiac failure? So cardiac failures and simple words, why cardiac failures are develops. The cardiac failures they are develops as a result of there is decreased cardiac output when the heart become unable to provide adequate amount of blood to the organs according to their needs. Now what actually happen during cardiac failure or congestive heart failures? There is inadequate supply of blood to the heart, and the heart become unable to supply sufficient quantity of the blood in order to fulfill the demand. We can say that blood pressure is equal to cardiac output multiplied by peripheral resistance of the blood vessels. Now why cardiac failures develop? The same case with hypertensions. Actually, vasoconstrictions occur at the level of blood vessels. So your blood vessels it become constricts. So the heart, actually the myocardium muscles, which is the strong muscle, and that muscles become incapable to receive the sufficient quantity of the blood, and it will definitely lead toward a condition like tachycardia. So the heart rate become elevated and hypertension occur. In cardiac failure, there is development of mean there is simple decrease the cardiac output. So when the cardiac output become decreased, the heart become not able, or the hearts can supply the insufficient blood to the body. When the heart become unable to supply or provide adequate amount of blood, so the organs according to their needs, so definitely it couldn't fulfill the demand. That's why you can see here the echocardiography, the ejection fraction that is less than 45%. So you will have to perform echocardiography. Congestive heart failure, the treatment of congestive heart failures, its main aim to reduce the preload and afterload and to increase the myocardial contractility. So the main objective is to increase the myocardial contractility. When the myocardial contractility increase, then the heart become able to supply sufficient quantity of the blood to different organ, different tissue, which is the normal need. So the treatment of congestive heart failures, the treatment of the congestive heart failures aims to reduce the preload and afterload and to increase the myocardial contractility mainly by the administration of. So these are the different drugs which I have mentioned here. That is AC inhibitor, angiotensin converting enzyme inhibitor. These are diuretics, and then beta blockers and alpha blockers, cardiac glycosides, organic nitrates, and cardioprotectors. So all these drugs they are used in the treatment of congestive heart failures. But we will explain all these categories step by steps. Now here we have used two terminologies. One is preload and the second one is afterload. Afterload. Actually, the preload mean actually this is simply it is used to describe actually the blood volume which is present in your heart at a given time. Mean the quantity or the amount of the blood which is present, especially in your heart at a given time. And freeload, the freeload is directly referred to the amount of blood which is already in your ventricles when you are ready to pump out. And then the afterload refer to the pressure against which your heart has to pump the blood. So these are the different terms you can use. Afterload, it is also known as systemic vascular resistance. Afterload is also called systemic vascular resistance. So actually this is the amount of resistance that the heart must overcome to open the aortic valve and push the blood out into the circulation. So as we have discussed in hypertension, systolic pressure and diastolic pressure. So during contraction of heart, that the blood can receive sufficient quantity of blood, and then it can leave to the other parts of the body. Now you can see these are some pathological factors which are involved in congestive heart failure. That is preload, that is heart disease, afterload. These are the different pathological factors which can directly affect the cardiac output or congestive heart failure. You can see here there is mean definitely when the peripheral resistance of the blood vessels they are high. So when the peripheral resistance of the blood vessel increases, then definitely the cardiac output will be low, and the heart will receive insufficient quantity of the blood. So mean when the peripheral resistance of the blood vessel become decreases, so it means that the heart will receive sufficient quantity of the blood and the cardiac output will increase, and it will supply blood to the heart in sufficient amount. These are the heart disease, and you can see this is preload vasodilator drugs. We will explain it inshallah in upcoming lectures and detail vasodilator drugs. And ACE inhibitors, diuretics, positive inotropes. So these are the different agents which are used in the treatment of congestive heart failure. So you can see here the cardiac output mean the heart is able to pump the blood to various parts of the body. This is the renal blood flow. So when the cardiac output increase, so ultimately the renal blood flow increase and the renin will be released. There will be the formation of angiotensin 2. Our main target is to stop the activity of renin which is released by the kidney. So renin it can ultimately convert the angiotensin 1 to angiotensin 2. So actually these ACE inhibitor they are its main target is to block the renin in order to stop the conversion of angiotensin 1 to angiotensin 2. So look at this chart. The renal blood flow increase, there will be the release of renin and the formation of angiotensin 2, and ultimately there will be release of aldosterone. So definitely the sodium and water they are retained inside the body and is a result of edema occur. This is actually the mechanism. Mean when more and more fluid they are accumulated inside your body, so definitely edema will be occur. Look at here, these are ACE inhibitor, angiotensin converting enzyme. So our main target is, so this is angiotensin converting enzyme system. This is the system which is responsible for the regulation of the blood pressure. So here the renin convert, with the renin actually this convert angiotensin 1 into angiotensin 2. These ACE inhibitor they are responsible to stop the activity of renin to avoid or to block, to stop the conversion of angiotensin 1 to angiotensin 2. These are AT1 receptor, angiotensin 1 receptor, and these are angiotensin 2 receptor. And the same case is here. These are kinins, and these kinins can be as the same case with bradykinins. So kinins with the help of kinase 2 enzyme they can break down and These are the different conditions which are associated with the hypertension and congestive heart failures. So, inshallah, in my next lecture, inshallah, we will start from the ACE inhibitors, and then onwards we will discuss each and every categories like ACE inhibitor, calcium channel blocker, beta blockers, and more like diuretics. So inshallah, we will discuss inshallah the remaining lecture inshallah in my next class inshallah. Thank you so much for watching my lecture.